Mima obibia love unity ba na dwumadi so say na nyina yenim say ya Wednesday here the health talk program ebrem na me a me di dwumadi ne ho tia me din di akosia na ene topic for discussion infertility and sterility. Na yeka infertility it's defined as infertility. We all know it's a disease that affects the male and the female reproductive system. And this is the inability or the failure to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. It is infertility na affect imani imema. After 12 months of regular unprotected sexual intercourse, it causes infertility. Now, it is usually not a natural state of a healthy adult. However, it is usually not a healthy state of a natural adult. Infertility may be classified as primary and secondary. And the primary infertility is the inability to have any pregnancy, whilst the secondary infertility is the inability to have a pregnancy after previous successful conception. Statistics and research infertility affects millions of people of the reproductive age worldwide. The estimates suggest that between 48 million couples and 186 million individuals live with infertility globally. And if you go around the globe, 48 million couples and 186 million individuals live with infertility. Back to sterility. Sterility is the inability to produce offspring, children, as a result of a procedure such as tubal ligation, hysterectomy, or vasectomy. This sterility, a surgical procedure which is done at the theater. It may taking one after the other. Tubal ligation is the procedure in which a woman's fallopian tube are blocked or partially removed, preventing the chance for a sperm and eggs to meet. This tubal ligation is purposely done for ladies and as a women. It's done to block the fallopian tube or sometimes partially removed to prevent the chance from traveling to meet to prevent the sperm from traveling to meet the eggs. So we all know that before fertilization will take place, a lady is supposed to release an egg and the man is supposed to release a semen or a sperm for it to fuse together. Now, vasectomy is the surgical procedure for male sterilization in which the male vas deferens are cut and tied or sealed so as to prevent sperm from entering into the urethra and thereby prevent fertilization of a female through sexual intercourse. This vasectomy is purposely done for men and as a guys. And they remove the vas deferens that produce the semen for it to pass through the urethra for fertilization to take place during sexual intercourse. But this procedure, if it is done, definitely during sexual intercourse, the guy will release semen, but the sperms will be present for fertilization to take place. Another one is hysterectomy. This is a surgical removal of the uterus. Hysterectomy can be caused due to accidents or a disease condition. Some disease conditions such as fibroid or myoma, if it happens to be within the uterus, it causes excess bleeding. So sometimes the uterus is being removed to save the woman's life, and some myoma or fibroid even so outside the uterus. It is a pawpaw that it's hanging on a tree. There was such a myoma and so on. It's another subtopic about etiology or risk factors for infertility. In males, problems in the ejaculation of semen, absence of low level of sperm, abnormal shape or movement, motility of sperm. And in male, no, we have absence of low level of sperm. And the normal circumstance here will average level, and I say average figure for a normal human being sperm was uncontaining. So if you are below that level, no, your reproduction, let me say, the rate at which your fertility is low. Let me put it in now. Fertility is low. It's your abnormal shape of movement, motility. Sometimes also the shape of your sperm, no, say abnormal, you are infertile, the movement of it, whether it travels fast or it travels slow. Conditions that affect the quality and quantity sperm, such as varicocele, accessory gland infection, testicular cancer, hypospadiasis, and etc. Disease conditions wey na varicocele, accessory glands infection, testicular cancer, cancer of the testicles, hypospadias, and others. Hormonal disorders leading to abnormality in hormones produced by the pituitary glands, hypothalamus, and testicles. Hormones such as testosterone regulate the sperm production. Previous groin surgery. Obi wɔ hɔ yɛayɛ ne surgery wɔ ne groin da. Ɛno nso tumi affect ne fertility rate. Overheating of testicles. Obi wɔ hɔ nom ne normal temperature for a testicles no ɔwɔ saa temperature no bi. The temperature for the testicles is so high to the extent that the testicles cannot do its work, and accept the work that it's supposed to do and to produce the semen, and to me say jumani yeba in man. So in female, fertility may caused by the following: disorders of the ovary such as polycystic ovarian syndrome and other follicular disorders. In ladies, we have something we call ovarian cyst. So if there is the presence of this ovarian cyst, cause the lady's fertile rate. If this ovarian cyst is not removed, the lady cannot conceive. Disorders of the endocrine system causing imbalances of reproductive hormones. Examples of common disorders affecting the system includes pituitary cancers and hypopituitarism. These are when endocrine hormones which are present in the ladies. No? If there are disorders of the endocrine hormones present for fertilization, you can't conceive. Uterine disorders which could be inflammatory in nature, such as endometriosis, congenital in nature, such as septate uterus, or benign in nature, such as fibroid. This endometriosis, no, you can't be congenital, then it means from birth. The person is having it from birth, but they didn't detect it earlier, and I said, they didn't do any follow up to prevent it. And your septate uterus, benign in nature, such as fibroid, which I earlier talked about. Say, if it's present in the uterus, they remove it and advise the lady to give birth if he or she is ready to give birth. If she delays in giving birth, a time to come, you remove all the uterus, because fibroid causes a lot of bleeding. Excessive bleeding may happen. If there is excessive bleeding, you may lose your life. Etiology or risk factors for infertility. Tubal disorders such as blocked fallopian tube, which may be caused by untreated sexually transmitted infection or complications of unsafe abortion, postpartum sepsis, or abdominal pelvic surgery. As I said earlier, say disease conditions being one you can't conceive because the fallopian tube, when an egg may travel from till its fertilization take place. And see, if you are having this STIs now, you are not being treated well. It causes block of the fallopian tube and complicated abortions. Even more, they are shy to go to the hospital if they don't want the pregnancy. They are shy to go to the hospital to seek medical attention. Maybe they want to do abortion. They won't go to the hospital to seek medical attention. Some go pharmacy to buy medication for themselves and cause illegal abortion, which is not safe. And a postpartum sepsis, abdominal pelvic surgery. This abdominal pelvic surgery can be caused through accidents or many things. When you accident, the pelvic no when you problem operating on the pelvic, and I say some other disease condition. In both males and female, heavy smoke and alcoholism can also be a risk factor for infertility. Long exposure to X-ray, chemotherapy, and radiotherapy. X-ray, we all know say it's a light that is being used now. So if you are exposed to this light, it destroys the endocrine hormones that stimulate fertility. See, both male and female destroy all those hormones. And chemotherapy, it's done purposely for our cancer patients. It's the use of chemicals to kill cancer cells in the body. And if these cancer cells are killed in your body, those chemicals affect your reproductive hormones in your system. Radiotherapy, and also it's purposely done for cancer patients to kill cancer cells in their body. Prolonged use of NSAIDs such as aspirin, ibuprofen, and others. This aspirin and ibuprofen, they all, if you take them or your body is, if you take them frequently, you are at a high risk of being infertile. Clinical manifestation. Clinical manifestation, what are the signs and symptoms that one may see or one may know that he or she is suffering from infertility? So your first point here, there are no outwardly visible signs of infertility. Most women are diagnosed with infertility only after they are unable to conceive for over a year. In case of infertility caused by ovulation disorders, the women may notice. Let me summarize it. We don't have specific signs and symptoms that you know that this person is infertile unless the person is being diagnosed after 1 year of not being conceived. And sometimes ovulation disorders may be noticed in ladies. Maybe nipani menstrual cycle is irregular. It's your first point oligomenorrhea, an irregular menstrual cycle. Menstrual cycle instead of 28 days, only the any day and also the menstrual cycle in about 2 days or 3 days, which is very bad. Another point amenorrhea, absence of menstrual cycle. Some people won't experience they won't receive they won't menstruate that month. Every time I was on menstruating, menses ni embakra. Obi wo about this month and next month emba. Obi wo on menses ni about this month and next month emba, which is very bad. Men may present the following: pain, swelling or lump in the testicular area. They feel pain in the testicles. Testicles so there will be around, and the pain will be around the testicles area, and there will be a presence of lump. If we do physical examination, and I say you can see the lump with erectile dysfunction. Under normal circumstances, we all know that a man is supposed to erect if he feel for sex, but due to this infertility, if you feel for sex, you not feel anything like your penis, and I say sorry, and I say excuse me to say, if the man see a woman's nakedness, I was saying sorry no, due to infertility when sorry, difficulty with ejaculation, low or no sperm production. During sexual intercourse, instead of the man to release semen, obi wɔ hɔ a ɔnrelease, anaasɛ ɔrelease koraa, it will be something small, but under normal circumstance, the way it's supposed to come no ɛmba saa because of this infertility. Diagnosis of infertility. In male, the following tests will be done to diagnose infertility. We have, when you come to the hospital, we do so many diagnostic investigation for us to know what may be the cause of the infertility. So the first thing that we do is physical examination of our hospital. This is done to detect lumps or deformity in the testicles, and the shape and structure of the penis will be examined for abnormalities. So when you come to the hospital, we do physical examination for you. We detect whether there is lump, whether there is the presence of lump in the testicles, deformity of the testicles, and the shape and structure of the penis, or we examine for any abnormalities of your male reproductive organ. Semen analysis. A sample may be taken to the test for sperm concentration, motility, color, quality, any infections, and presence of blood. In Tuba Hospital, we take sample of your semen to the lab to look for concentration level, motility, how your semen travel, the color of your semen, the quality it's supposed to be, if there is a presence of infection. So we do that. All the semen, they call diagnostic investigation. It will detect the infection level, or sometimes there may be a blood in the presence of the semen. Blood test. A laboratory test will be performed to check for the level of testosterone and other reproductive hormones in the blood. Until you take your blood sample to the lab, now checking if there is the presence of testosterone and other reproductive hormones. So if all those reproductive hormone or the testosterone are absent, then it means you are infertile. Ultrasound is also done. This is done to reveal issues such as ejaculatory duct obstruction or retrograde ejaculation. There is a machine that we use to examine, your organs in your body. This is done for men. The examine your ejaculatory duct if there is obstruction, and I said there is a retrograde ejaculation. The next subtopic is female diagnostic investigation. Your first point here, your first point here, hysterosalpinography. This hysterosalpinography is done through injection of the fluid into the woman's uterus, and X-rays are taken to determine whether the fluid travels properly out of the uterus and into the fallopian tubes. If a blockage is present, surgery may be done. Some ladies' fallopian tube are blocked. If there is a blockage of this fallopian tube, they are supposed to irrigate the fallopian tube for you, and this is done through a surgical procedure. Into this hysterosalpinography is injection of a fluid into the uterus. It is done through an X-ray machine to see if how the fluid travels an answer to see if the male releases, how the semen will travel into your ovaries, your fallopian tube. Blood test. It is done to assess the hormonal levels and to check if the woman is ovulating. They take a sample of the lady's blood and they call lab to check if there is access of hormonal levels and the ovulating period, or the ovulating cycle of the woman is accurate or okay. Pelvic ultrasound to produce an image of the uterus, fallopian tube and ovaries. Tina mema no so man so pelvic ultrasound. Most ladies will testify, I mean those who are pregnant, nyim no mo hospital, some go scan. The machine be what is present in their uterus, the fallopian tube, the ovaries. If there is the presence of ovarian cyst, there is the presence of fibroid in the uterus or around the uterus, or the fallopian tube is blocked. You use this machine to detect all those things. Another diagnostic investigation, laparoscopy. This is done through a thin, flexible tube which a camera at the end is inserted into the abdomen and pelvis, allowing a doctor to look at the fallopian tube, uterus, and ovaries. This can reveal signs of endometriosis, scarring blockages, and some irregularities of the uterus and the fallopian tube. And also, it's a machine. It's very expensive, and most people cannot afford for it. This is done through a machine which has a camera, and it's being passed through it's being inserted into the abdomen and pelvic for a doctor to visualize whether there is a blockage in the fallopian tube, the uterus, and there is a presence of ovarian cyst or other scarring blockages or irregularities of the uterus and fallopian tube. Endometrial biopsy. This is also done to examine the lining of the uterus. The uterus is having a lining. If they do this endometrial biopsy, we check if there is the presence of the lining. If there is not the presence of the lining in the uterus, then we assume you are being infertile. Complications. Like I said, this infertility, what does it result to, and what are the complications about it? 1. Fear of losing partners. We all know this, our Ghanaian society. When you are pregnant, most people are expecting you to conceive and deliver. So after 1 year or some months to come, and you have not conceived or you have not given birth, the society will be mocking at you. Even your own in-laws will be giving you a problem at home. When are you giving us our grandchild? Sometimes the partners, if ladies, most ladies are scared to lose their partners, and some guys too are also afraid to lose their wife because of this infertility. Diminished confidence and self-esteem. Some people lose confidence in themselves, asking so many questions of themselves. Why have they done something wrong, or what is the problem? And a whole lot. Depression also sets in. People are being depressed. They overthink to the extent that this depression can also result into another disease condition, which is hypertension and diabetes. Anger. Most people are being angry, because they ask themselves, what is causing me not to produce, or what is causing me not to conceive? So the least thing, and I said, any people closer to them, another point, so you're guilty. Some people feel guilty of themselves. They start to ask themselves, what is the problem? Then they hear me, and I say, why is it that I'm the only one who cannot conceive? A whole lot of things. This infertility is causing broken homes or breaking people's marriage. People are being divorced due to this infertility, and it's a whole lot of things going out in the world, which I earlier said that many couples are living with infertility, and some leads to divorce and others. The next subtopic is management of infertility. Over hospital now, your diagnosis of infertility. What are the management? We have we have medications that we use to treat infertility. We have medical management and surgical management. So I'd like to talk about the medical management. The medical management, we have clomiphene citrate. They are medication taken orally orally. This drug stimulates the ovulation by causing the pituitary glands to release more follicle stimulating hormone and luteinization hormone, which stimulates the growth of an ovarian follicles containing the egg. Sinamedi Kanka said we have hormones that we have reproductive hormones, which are follicle stimulating hormones and luteinization hormones. So if you are taking this clomiphene citrate, they stimulate your follicle. This medication will stimulate your follicle hormones and luteinization hormones, and your ovarian hormones will be containing an egg. Another point, so you're gonna do gonadotropin such as gonal follistatin, and also you're stimulating hormones for fertility. Now, another medication service here, letrozole, and also your medication that you give for infertility. Now, about surgical management, your intrauterine insemination. This is a type of artificial insemination procedure performed to treat infertility. Sperm that have been washed and concentrated are placed directly in the uterus around the time your ovary releases one or more eggs to be fertilized. See, this management is very expensive. Most people cannot afford for it because it's a surgical management which is done at the theater, and it contains a lot. And if you do this surgical management, it's not 100% sure that you conceive. 50-50 at the end of the year. So if you are able to conceive, then hallelujah, praise the Lord. But if you are unable to conceive, you have to undergo it again till the time that you will be conceived. In vitro fertilization. This is a procedure performed to help in the conception of a child during IVF. Mature eggs are collected, retrieved from ovaries, and fertilized by the sperm in the lab. Until this surgical management is also expensive. It's also done at the lab, or no, it's done at the theater. They take the woman's egg and take the man's egg and form it and fuse them together at the lab. So when fertilization takes place, they re-put the fused zygote into the woman's uterus to grow. So it entails a lot. As I said earlier, it's not 100% assured. Say if you do this, you will conceive. They conceive although, but later in the within their first or second trimester, they lose the baby. So it's not 100% guaranteed. Myomectomy. This can be done if fibroid is the cause of the infertility. As I said, there is the presence of fibroid in the uterus. It also causes infertility because it grows. Fibroid grows as the baby grows. So if the woman is conceived, the fibroid can overtake the baby. It cause the woman to lose the baby, and I say, cause what's the name? Miscarriage. Yeah. So if there is a presence of fibroid, myomectomy is done, which is removal of the uterine fibroid. Sometimes if they remove the fibroid, and you say embryo, it's a living thing that grows, so definitely it will grow again. So we advise patients, if they are done with their myomectomy, they should give birth as early as possible to prevent this excessive loss of blood. So if they are done delivery, they can come for a hysterectomy to be done, which is the removal of the uterus. And we also prepare our we also manage our patients psychosocial management, let me say psychological management. So as you come to the hospital, we are treating you for infertility. We also take you to the counseling department for guidance and counseling of couples. Some people, due to infertility, they want to divorce, or they want to divorce their marriage, which is very bad. Some people too, there will be problems at home, today this, today that, and a whole lot of things. We also educate on a healthy lifestyle, such as healthy eating habits. Over hospital, we educate you on the foods that you eat for it to stimulate your follicle stimulating hormones for you to be fertile. We advise you on that, and things that you are not supposed to eat. Hormones for you to not to be fertile. So we advise you against them too. Another subtopic here, prevention of infertility. What are the things that we will do to prevent infertility? Prevent infertility. Our first point here, avoid heavy drinking and smoking. Both women and men are also smoking. Until if you come to the hospital, we assess you who say you are one of those who smoke and drink, we advise you medically to stop, because smoking and drinking results to a whole lot of problem. Avoid exposure to industrial or environmental toxins which can affect sperm production, especially those who live at the industrial areas. Industries, they produce a lot of toxins which are very harmful to our body. So we advise them not to live around those places. Avoid high temperatures. Maybe you stay at a place that the temperature is very high. Under normal circumstances, instead of your body temperature to be normal, your body temperature is very high. It also affects your hormonal levels. Treat all underlying conditions that may lead to infertility. Example, gonorrhea, which can cause an irreversible obstruction of the sperm duct. We know this sexually transmitted disease, as I said earlier, if they are not treated well, it causes blockage of the fallopian tube and obstructs the sperm duct. If you have this sexually transmitted disease, please, I will advise each and everyone to seek a medical attention. Get vaccinated against diseases that affect spermatogenesis, example rubella, mumps, and measles. All these rubella, mumps, and measles, they are diseases that affect the spermatogenesis. So we have vaccines for them, that when there are disease outbreak, and as a baby, we have the 6 killer disease. You vaccinate to prevent all these diseases. Vaccine, if you go to the public health unit, you have vaccine for all these type of diseases. Limit the use of non-steroidal anti-inflammatory drugs, aspirin, ibuprofen, and others. They are all NSAIDs. It affects the fertility rates for both men and women. Avoid trauma to the reproductive organs. Sometimes, accidentally, we get traumatized to our reproductive organs, which can lead to infertility. This accident can be a road traffic accident, motor accident, bicycle accident, or maybe domestic accident, which is a fall. It may affect your pelvis and answer your testicles. I'll encourage everybody to be careful with this trauma to the reproductive organs. Okay, Meda Obi Biasi, and Edumedi ni the Beba Eweye, Dafu for the Besson Shia, Yamidi Jumedi Chiamidi the Afusia, Meda Obi Biasi for any time our mamma. Bye bye.